If you are aggressively stretching your lower back right now to fix that sharp, shooting electrical pain running down the back of your leg, I need you to stop immediately. There is a very high chance that by doing those standard lumbar stretches, you are actually strangling the exact nerve you are desperately trying to heal, that sharp, burning shock running down the back of your thigh, the one that makes you freeze in your tracks and wonder if your leg is about to give out. There is a massive misconception in the medical and fitness world right now, and thousands of seniors are suffering because of it. There is a very high probability that your pain isn't coming from a degenerating spine at all. You might be dealing with what we in the clinic call fake sciatica. I'm Dr. Marcus Thorne. For over 2 decades, I've worked as a physical therapist specializing in senior mobility, chronic joint pain management, and helping adults over 55 avoid completely unnecessary orthopedic surgeries. In my clinic, I see patients every single week who are terrified that their spine is crumbling or that they have a severely herniated disc simply because their leg feels like it's on fire. They are doing everything they are told to do, but their joints and nerves just keep hurting. By the end of this video, I am going to give you a very simple, very safe, at-home test to help you determine if your shooting leg pain is actually coming from a structural spinal disc issue or if it is being triggered by a tight, incredibly stubborn hip muscle. And more importantly, I am going to show you the exact chair-assisted stretch you need to finally release that trapped nerve safely. But before we dive into the anatomy of what is actually happening in your body, I want to hear from you. Tell me down in the comments, does your leg pain flare up the most when you are sitting completely still in a chair or in that exact moment when you first try to stand up and bear weight? Let me know below, because your answer is a huge clue. Let me tell you about a patient of mine. We'll call her Eleanor. Eleanor is a 68-year-old retired school teacher living in Scottsdale, Arizona. For years, she was the picture of an active senior. She loved her morning walks, she gardened, she played with her grandkids. But about 6 months ago, everything came to a grinding halt. She was stepping off a curb when a sudden, electrical jolt shot deep from her right buttock down the back of her thigh and wrapped right around the outside of her calf. It was paralyzing. Over the next few weeks, the pain became a constant, dull, throbbing ache that would occasionally erupt into those terrifying lightning bolts of pain. Her primary care doctor gave her a quick physical, diagnosed her with classic sciatica, and handed her a sheet of paper with standard lower back stretches. He also told her to apply a heating pad to her lumbar spine. Eleanor was diligent. She did the knee-to-chest stretches. She did the spinal twists. She sat with a heating pad on her lower back every evening. And her pain got significantly, undeniably worse. When Eleanor finally sat in my clinic, she was in tears. She was using a cane just to get from the waiting room to my office. She told me, "Dr. Thorne, my spine must be completely worn out. It feels like bone on bone in my back and the nerve is just crushed. I'm going to need surgery, aren't I? I'm losing my independence." I examined Eleanor and I immediately asked her to stop stretching her back. Eleanor didn't have a spinal disc problem. Her lower back, while showing some normal age-related wear, was perfectly fine for a 68-year-old woman. She did not have severe spinal stenosis. She did not have a massive herniated disc pressing on her spinal cord. Eleanor had piriformis syndrome. This is the hidden conflict that so many older adults are facing right now. We hear the word sciatica, and we immediately think of the spine. We picture slipped discs and degenerating vertebrae. But sciatica is actually just a symptom. It simply means the sciatic nerve is irritated. It doesn't tell you where the nerve is being irritated. To understand why your stretches are failing, you have to understand the biological route of the sciatic nerve. It is the longest and thickest nerve in the human body. It starts in your lower back, yes, but then it travels down deep through your pelvis. And right in the middle of your glute, deep inside your buttock, is a small diagonal band of muscle called the piriformis. Its job is to help your hip rotate outward. But here is the critical design flaw in human anatomy. The massive sciatic nerve passes directly underneath, and in about 15% to 20% of the population, it actually passes straight through this piriformis muscle. As we age, our daily habits change. We sit more. We might develop a slight limp from a sore knee, or we lose some core strength. This causes the piriformis muscle to become overworked. inflamed, and incredibly tight. It clamps down like a vice grip. And what is caught right in the middle of that vice grip? Your sciatic nerve. The muscle physically strangles the nerve. This sends shooting, burning, electrical pain all the way down your leg to your foot. It mimics a spinal disc herniation perfectly. That is why it's called fake sciatica. Think about what Eleanor was doing. She was pulling her knees to her chest, trying to stretch her lower back. But by doing that, she was pulling the sciatic nerve taut. She was basically taking a nerve that was already caught in a vice grip and yanking on it. No wonder she was in agony. No wonder the heating pad on her lower back did absolutely nothing. The fire wasn't in her back. It was deep in her hip. We see this all the time. Seniors who are desperately trying to heal their joints, doing all the right things, but applying the medicine to the completely wrong part of the body. So, how do you know which one you have? How can you tell if that shooting pain in your leg is a true spinal issue that requires one type of care, or if it's a tight piriformis muscle choking the nerve, which requires a completely different approach? It all comes down to a specific way your hip moves. I call this the seated figure forecheck. It is a highly effective, beautifully simple way to isolate the mechanics of your pelvis from the mechanics of your lumbar spine. But before we do this, a quick medical caution. If you have had a recent hip replacement, if you have been diagnosed with severe hip osteoarthritis, or if you have advanced osteoporosis, please skip this specific movement or consult your physical therapist first to ensure your joint can safely handle the rotation. For everyone else, here is what I want you to do. Sit forward on the edge of a firm chair. Plant both feet flat on the floor. Sit up incredibly straight. Do not slump your lower back. Now take the ankle of your painful leg and gently lift it, trying to rest it squarely on the knee of your non-painful leg. It should look like you are crossing your legs to read the newspaper, making the shape of a number 4 with your legs. Now, pay very close attention to what your body is telling you. If simply getting into this position or gently pressing down on that elevated knee sends a sharp, searing pain deep into the center of your buttock cheek, or immediately shoots that familiar electrical zing down your thigh, you have just found a massive clue. That is a glaring red flag that your piriformis muscle is the culprit. Why? Because in this position, you aren't bending your spine at all. Your back is completely straight. You are purely utilizing the external rotation of the hip joint, which forcefully stretches that deep piriformis muscle directly over the sciatic nerve. If your problem was truly a herniated disc in your lumbar spine, moving your hip joint while keeping your spine perfectly rigid shouldn't trigger that massive, localized electrical surge in your glute. Let's talk about the biological reality of why this happens. Because understanding this mechanism is the key to finally getting your life back. Think about how our daily habits change as we get older. We tend to sit significantly more. We sit watching television, we sit driving, we sit reading. When you sit for hours on end, your primary glute muscles, the big powerhouse muscles of your backside, essentially fall asleep. They become neurologically inhibited and physically weak. To compensate for this weakness, the tiny, diagonal piriformis muscle has to step up. It has to work overtime to stabilize your pelvis every time you stand up, walk, or climb a flight of stairs. It is doing a job it was never designed to do alone. Because of this chronic overwork, it goes into spasm. It hypertrophies, meaning it physically thickens and swells. And remember the design flaw in our anatomy. The sciatic nerve runs directly beneath this muscle, and in about 1 in 6 people, it actually pierces right through the belly of the muscle itself. That swollen, spasming piriformis literally crushes the nerve against your pelvic bone. The nerve gets inflamed, it gets angry, and it sends a distress signal in the form of a burning shock down your leg. You are treating a spinal issue, but you actually have a hip mobility and soft tissue entrapment issue. Let me introduce you to Arthur to show you how easily this goes wrong. Arthur is a 71-year-old retired mechanic from just outside Chicago. He had this exact type of shooting pain down his left leg. Arthur is a proactive guy, so he went online and bought one of those expensive, heavy-duty percussion massage guns. Every single night he would hammer away at his lower back, right over his lumbar spine, thinking he was loosening up the muscles around his slipped disc. He also slept with a heating pad strapped to his lower back, but he wasn't getting any better. In fact, the vibration of the massage gun actually agitated the nerve roots near his spine, but he wasn't even touching the source of the compression. When he came into my clinic, I had to physically take the massage gun away from him. I showed him that the real knot, the actual vice grip, was 3 inches lower and buried deep beneath his gluteus maximus. When we finally stopped attacking his lower back and started releasing his piriformis, his sciatica vanished in 2 weeks. He had been applying the right idea to the completely wrong zip code. Then there is Linda, a 64-year-old grandmother from Portland. Linda is a classic case of what we in the medical field call fear avoidance behavior. She felt that electrical shock in her leg, Googled her symptoms, read the word sciatica, and immediately convinced herself her spine was crumbling. She stopped gardening. She stopped walking to the mailbox. She stopped picking up her grandchildren. She basically put herself on permanent voluntary bed rest to protect her fragile back. Here is the tragic irony of Linda's situation. By stopping all movement, her major glute muscles became even weaker, and her piriformis muscle tightened up even more from all the prolonged sitting and laying down. By trying to protect her spine, she was actively feeding the very monster in her hip that was causing her pain. This is why getting the correct diagnosis is absolutely critical, and why you must advocate for yourself in the medical system. The next time you are sitting in your primary care physician's office and they start talking about ordering an expensive MRI for your lower back because of your leg pain, I want you to ask them this exact question. Doctor, before we focus entirely on my spine, could this be a muscular entrapment of the sciatic nerve, like piriformis syndrome rather than spinal radiculopathy? Write that down. Radiculopathy is the medical term for a pinched nerve root right at the spinal column, caused by a disc or bone spur. Muscular entrapment means the nerve is being choked further down the anatomical line by soft tissue. A good doctor will appreciate that specific question, and a good physical therapist will know exactly how to palpate and test for it. It changes the entire trajectory of your treatment, from contemplating spine surgery to prescribing targeted soft tissue rehab. I'm curious as you're listening to this. Think about your own habits and your own pain. Does Arthur's story of stubbornly treating the wrong area, or Linda's story of stopping all movement out of fear of joint damage, sound more like what you go through every morning? Let me know in the comments below. Reading your experiences truly helps me know what specific topics and body parts I need to cover in my upcoming videos. So, the massive question remains. If you suspect you are dealing with fake sciatica, if that seated figure 4 test lit up your hip and your standard lower back stretches have been failing miserably, what do you actually do about it right now? How do we get that stubborn, spasming muscle to finally let go of the nerve without pulling the nerve tighter and causing more damage? We need to completely rethink your stretching routine. We need to talk about the specific recovery protocol and exactly why you must stop pulling your knees to your chest and start doing a highly specific chair-assisted modification instead. Here is the exact protocol I use in my clinic to treat fake sciatica. It is a 3-step process designed to stop the muscle spasm, calm the inflamed nerve, and safely restore your mobility without putting any dangerous pressure on your lumbar spine. Step 1 is the seated hinge stretch. This is the chair-assisted modification I mentioned earlier, and it is vastly superior to pulling your knees to your chest on the floor. When you lay on your back and pull your knees up, you are rounding your lower spine, which puts massive pressure on your lumbar discs. We want to leave your spine completely out of this. Sit on the edge of a sturdy chair with your feet flat on the floor. Take the ankle of your painful leg and place it over the knee of your good leg, just like we did in the diagnostic test. Now, here's the absolute most important part of this movement. Sit up as tall as you possibly can. Imagine a string pulling the top of your head toward the ceiling. Your lower back should have its natural, slight inward curve. Do not slouch. Do not round your shoulders. Keeping that spine perfectly straight and rigid, I want you to simply hinge forward from your hips. Lean your chest directly toward your shin. You probably won't have to move more than 2 or 3 inches forward before you feel a profound, deep pulling sensation right in the center of your buttock cheek. That is your piriformis muscle finally being forced to elongate. Hold that position. Do not bounce. Bouncing triggers a stretch reflex that will make the muscle snap back even tighter. Just hold it and take deep, slow breaths. I want you to hold this stretch for 30 to 45 seconds. If you feel a mild recreation of that shooting nerve pain, back off just a fraction of an inch until it's only a deep muscle stretch. You want to coax the muscle into relaxing, not force it into a panic. Perform this stretch 2 to 3 times on the painful side, twice a day. Step 2 is fixing the temperature mistake almost everyone makes. Remember how Eleanor was putting a heating pad on her lower back every night? Heat feels wonderful on tight, tired muscles, but it is the absolute worst thing you can do for an inflamed nerve. Heat dilates blood vessels and draws fluid into the area. If your piriformis is already swollen and crushing the sciatic nerve, putting heat on it is like pouring gasoline on a fire. You are increasing the inflammation in a space that is already too tight. Instead, I want you to use ice, and I don't want you to put it on your lower back. I want you to place an ice pack wrapped in a thin towel directly over the center of your glute, right over the meaty part of your buttock where that deep ache originates. Sit on it or lay on your side with it for 15 minutes at a time. The cold will penetrate deep into the tissue, constrict those blood vessels, reduce the swelling of the piriformis muscle, and literally numb the angry sciatic nerve. Step 3 is temporary stride adjustment. While you are healing this muscle, it will be very sensitive to overstretching when you walk. For the next 10 days, I want you to purposefully shorten your walking stride by about 20%. Take slightly smaller, brisker steps. When you take a long, reaching stride, you pull the sciatic nerve taut against your pelvis. By shortening your stride, you give the nerve a little bit of slack, allowing it to glide smoothly without getting caught in the hip mechanism. Let's go back to Eleanor from Scottsdale. Once we realized her spine was fine and her piriformis was the real culprit, we completely changed her routine. I told her to stop all of the lower back twists and knee-to-chest stretches immediately. We threw out the heating pad protocol. Instead, she started doing the seated hinge stretch twice a day, focusing purely on keeping her spine straight. She iced her deep glute every evening while watching television, and she temporarily shortened her walking stride. Within 10 days, those terrifying electrical shocks that were dropping her to her knees completely stopped. The vice grip had been released. Within 3 weeks, the dull, throbbing ache was gone. By the end of her first month, Eleanor was back to walking 2 miles a day around her neighborhood, completely pain-free, without her cane. She got her life and her independence back, not because we scheduled a risky spinal surgery, but because we stopped treating the symptom in her back and started treating the mechanical truth in her hip. You do not have to live in fear of your spine crumbling. You just need the right diagnosis and the right tools. Now I want to hear from you. Comment, starting today, down below if you are going to try this chair-assisted seated hinge stretch we just covered. Comment, asking my doctor, if you plan to bring up piriformis syndrome at your next medical visit. And if you know someone who is constantly rubbing their lower back and complaining of shooting leg pain, please comment sending this and share this video with them. It might just save them from an unnecessary surgery. Most importantly, make sure you hit that subscribe button right now, because next week I am releasing a 10-minute follow-along routine specifically designed for safe sciatic nerve flossing, and you will not want to miss it. I'm Dr. Marcus Thorne. Take care of your joints, trust your body, and I'll see you in the next video.